Hoy vamos a hablar de salud y estilo de vida, porque la obesidad es una enfermedad del siglo XXI. Es una verdadera epidemia en todo el mundo, pero en nuestro país nos afecta particularmente. Según la Organización Mundial de la Salud, el 65% de los dominicanos son obesos o tienen sobrepeso, una cifra que supera el promedio de América Latina y el Caribe, donde se registra un 58% de obesidad. Este es para nuestro país un grave problema de salud pública, porque está asociado a muchos otros problemas de salud, como las enfermedades cardiovasculares, diabetes tipo 2, hipertensión arterial, cáncer, entre otras. Sus causas son múltiples, pero los dos principales son comer alimentos de alto contenido calórico y en porciones muy grandes y la falta de actividad física. Por eso, la mejor forma de prevenir o revertir la obesidad es adoptando un estilo de vida saludable. En los Estados Unidos hay una rama entera de la medicina que se dedica a promover el estilo de vida saludable, es decir, que nos enseña a elegir los alimentos y el tipo de ejercicio que no solo no nos enferma, sino que nos permite, en muchos casos, revertir enfermedades crónicas como la diabetes. Para enterarnos, vamos a hablar con el doctor George Guthrie, quien es médico estadounidense y autor del libro Eat Plants, Feel Whole, quien también atiende pacientes con enfermedades crónicas y que nos habló de cómo mantenernos sanos y cómo tener un buen sistema inmunológico fuerte, algo particularmente importante hoy en medio de esta pandemia. Doctor George Guthrie, muchísimas gracias por estar con nosotros. Es especialista en medicina de estilo de vida y queremos que nos explique de qué se trata esta rama de la medicina.
Lifestyle medicine is the practice of medicine that focuses on human behavior. You know, many of our chronic diseases, diabetes, heart disease, obesity, hypertension, are related to our behavior choices. Whether it's lack of exercise or dietary indiscretions, as our weight starts to go up, these diseases tend to follow in their wake. And so lifestyle medicine tries to aim at the cause of the disease, deal with the real underlying behaviors and fix those.
Entonces, ¿cuál sería la diferencia con la medicina tradicional?
Allopathic medicine tends to look for a diagnosis and then apply the evidence-based treatment. And most commonly, that's a medication or a procedure of some diet, exercise, sleep, hydration, rest. I mean, all of these things come into play when we're talking about improving health.
Y una pregunta, doctor, ¿esta medicina de estilo de vida se enfoca en la dieta?
Is to eat a diet, choose foods that have high amounts of fiber and low amounts of refined carbohydrates. So foods that are beneficial, for example, might include, let's say, a sweet potato. I mean, that would be a very good kind of basic food to help decrease inflammation. Of course, greens, vegetables, and fruits of all kinds are also excellent.
Muy bien, doctor, tenemos que comer vegetales, pero la gran pregunta, ¿qué pasa con la carne?
Another thing that these whole plant foods have is a lot of fiber. And the soluble fiber especially acts as a little bit of a sponge, even a physical barrier to keep the sugar from going into the blood vessels quite so fast. The same sugar can be released more slowly, so the blood sugar never goes so high, and so there is not so much of an inflammatory response. So when you eat a diet that's high in animal protein, you increase the acidity in the blood, which increases the inflammation. Now, we could focus on the plant protein that is best for us, and that would be the legumes, the beans, whether it's navy beans or kidney beans or black-eyed peas. The beans tend to be as high in protein as far as percent of calories as the animal products themselves, the meat, the muscle part of the meat. But the other calories, not being fat, high calorie, in the beans is actually a complex carbohydrate which is released slowly into the bloodstream.
O sea que usted me está diciendo que tenemos que ser vegetarianos.
So moving from animal protein to plant protein is actually a very good move. Now, that doesn't mean one needs to become a vegetarian or a vegan. I like to say use animal products as a condiment, as a flavoring. Usually when we go into the restaurant, we'll say, I'll have the fish, or I'll have the chicken, or I'll have the beef, whatever our favorite is. And if there happen to be some vegetables on the plate, we'll say, oh, that's good, I've got some vegetables. We should be going in and saying, I'll have the vegetables, and if there happens to be a little meat for flavor, then we can say that that's good. That would be a healthier way of approaching the eating process.
¿Podría este tipo de medicina entonces revertir las enfermedades crónicas? Ok, pero ¿cómo se hace esto?
Allopathic medicine, as usually practiced with the pills, because it's not really treating the cause, cannot reverse the disease, especially these chronic lifestyle-related diseases. The only way to reverse the disease is to actually get to the underlying cause and change that. Once you fix that, then the physiology comes back into its normal balance, and disease can often, not always, the disease can often be reversed.
¿Y cómo puede minimizarse la inflamación en el organismo?
There's a common denominator that comes in, or several common denominators that come in to these diseases, whether it's diabetes or heart disease or hypertension or obesity. And one of those common denominators is higher insulin. Another one is inflammation. When you increase inflammation, you actually increase the pathology of the disease, whether it's a neuropathy in diabetes or retinopathy in the eyes or atherosclerosis from heart disease. So this inflammation is just part of this whole process. And it would be best if we chose a lifestyle that actually lowered that inflammation.
Y en términos de ejercicios, ¿qué es lo más recomendable?
So exercise can be very helpful to help lose weight and to decrease inflammation. If you're trying to lower your blood sugar, walking for 10 to 15 minutes, about 30 minutes after you eat, is a great way to decrease the inflammation in the blood vessels coming from elevated sugar. So I recommend that for my patients who have diabetes as a way of managing blood sugars and inflammation. Regular exercise, generally 20 to 30 minutes a day walking is a good place to start, 5 days a week, but technically you'd do better if you increase that to around an hour a day. It doesn't have to be all at once. It can be broken up, and even kind of walking after each meal can count for that. Now, I will tell you that if you decide you're going to do marathon running and push yourself really, really hard, there's evidence that you get an increase of inflammation and a suppression of the immune system. So I'm not really talking now to the high-end athlete. I'm talking to people who are usually sedentary in their life like I am, who have to plan some exercise into their life, either at their lunch break or at the beginning or the end of the day. That exercise can really help decrease inflammation, manage the weight, and keep us healthier.
Finalmente, doctor Guthrie, yendo al tema del COVID-19, se dice que las personas que sufren estas enfermedades crónicas de las que hemos estado hablando tienen mayor riesgo de mortalidad si se infectan con el virus. ¿Es así? ¿Usted puede confirmarnos eso?
The highest risk factor that we have for this disease, at least at present, to my understanding, is obesity, accounting for about 60%. And obesity tends to increase inflammation because of the fat cells. But hypertension and diabetes are also extremely important as far as risk factors for this COVID virus. Having an immune system that is not overly actively and overly inflamed means that there's less kind of negative response. And apparently, healthy people who are meeting this virus are often having few to no symptoms.
Muchísimas gracias, doctor Guthrie, por arrojar luz en el tema de la medicina de estilo de vida, que es aquella que busca hábitos saludables para las verdaderas transformaciones. Así que gracias por estar con nosotros. Nos vemos en otra entrega de Unidos.